variant. But we have more tools in our toolbox now, and I think we need to really reconsider where we're at as far as our mask policy update is.
The thing that stands out to me is that independent about whether a school has a masking requirement or not, there is no better or worse data or numbers to support one position or another.
Masks based on different levels. I think the numbers are coming down, and if we follow the course of that plan, the mask will become optional at some point.
Yeah, there's children running around the hallways. They have theirs down here by their nose, or they're using them as chin straps. And I think we ought to take a very serious look at really, what they are.
Looking at this mask policy, because that's what I'm talking about. What if we were really just talking about the health of our kids? Who's responsible for that? What authority people should have over other people's kids? What are the negative consequences of wearing a mask to a kid in school trying to learn a foreign language? What are the negative consequences to these kids when they're trying to interact with one another?
This waiver, the student immunization waiver. I sign where it says, for personal conviction reasons, I have chosen not to vaccinate this student with the following immunizations. I know this isn't about immunizations, but I have the right to choose that if my son gets vaccinated or not. I was given that duty, obligation to do what's best for my child. My God-given right.
First grade, a crucial year for learning how to read, listening to sounds, watching how sound is produced. There are some dreadful consequences of masking kids at that age, at that level, especially that K-3, although I don't agree with masking anyone, but especially K through 3. They are crucial years. You can't go back and pick those up again. Kids have to see how sound is produced in order to make sounds, to make words, and eventually sentences. It affects their reading levels in many ways. And socially, as a counselor, I think it's dreadful that you expect kids to interact with people when you can't even see them. You probably can't hear them. And again, developmentally, it's very important for kids to have that social learning from other children, from their teacher. They can't tell if their teacher's upset with them because they can't read all those cues. When they only
While it's true that this last week and several weeks there have been no deaths in the 0 to 19 age group, which I'm grateful for, the greatest number of new cases occurred between the ages of 10 and 19, positive cases. While this doesn't necessarily correlate to deaths in that age group, it does correlate to the increased surge in cases we've been seeing overall. So while I am eternally grateful that our children are not dying from this disease, other folks in our community are.